fact that employers get charged triple the amount to insure a senior employee. This is one of the fundamental causes of senior unemployment, of seniors getting offered early retirement packages, et cetera. In fact, under Trump Care, they were going to up that to 5 times the amount. Let us have Bill talk about this particular issue and what can be done about it, besides single payer.
Yeah, that's for sure. That's the obvious answer, Vince, but I can tell you that approaching those years, I hate to hear that. But I have to say that the older folks that are, you would think that with the great power and all you hear about is how the older generation, the baby boomers, are out voting all the time. You would think there's fertile ground for Medicare for All and single payer to reach out and capture a lot of folks to embrace the change that is needed. Now, I don't know, beyond us talking to people and trying to get through the thicket of all the issues that intersect healthcare. I mean, this is not a standalone issue, standalone problem, whether it's pharmaceuticals or the healthcare system in the country. Everything is a fabric together. And the biggest problem, I think, is that you have the divisive politics. You have folks who have been conditioned or through propaganda, through places like the Fox News Network and Sinclair and all those late night radio shows that you have with these extremists on. And it divides the electorate. You have people many people, and unfortunately probably a few people in this room, who actually go out and vote against their interests. They vote against their interests over things like abortion, things like this pro-life and pro-choice. And when I reflect on that, studying this for years, you probably can't calculate the damage that dichotomy has caused to politics in this country. And we need to evolve past that one issue to be pro-women. My stance is pro-women, and that I don't see any reason that I should be telling you what to do with your body. Can you imagine a bunch of women in Congress or out in Harrisburg creating laws that affect our health care? You can't even think of it. But yet what's the first thing the other side does when they get to open their new session? It's all abortion politics. And it's all a distraction, and it's divisive, and it's damaged our country. And those are the things that have to change. There's a whole host of issues. Talk till midnight. Thank
you. I think the question was about the age disparity issue, and I'd like to address that. You know, Washington and government down there, we know is a matter of compromise. I mean, the great legislation that occurred over history did not happen overnight. If you look at this whole debate in healthcare, the first time universal healthcare was ever mentioned was in 1912 by Theodore Roosevelt. It was in his platform. 1912. Nothing happened until 1945 when Harry Truman made a push for national health insurance. That didn't go through. And then we get to the 60s, and finally Lyndon Johnson signed Medicare, Part A and B. It was a great achievement. And then a few years later, we expanded Medicare. We expanded to not just people over 65, but people under 65 with disabilities. We expanded it later for renal failure diseases, for hospice care was later included under, I think it was Nixon. And then under George H.W. Bush, we got Part D with prescription to add it to it. So history shows us that reasonable people, if we would send reasonable people to Washington on both sides, can get things accomplished. Now, here's what I think. Although I have no problem with the bill, you know, I'm realistic, and I think it'll be hard to pass this because we're just not going to make that jump. So to address your issue, Sir Vince, I think that we should let's get our foot in the water and let's put some other bills out there also that starts to reduce the age of Medicare from 65 to 60 or maybe 55. And let's take out of the pool older folks. You know, as we get older, and I'm 62, we start to develop health issues. Let's put that in Medicare, and perhaps it will have a positive influence on the current system of bringing premiums down for people between 18 and 55. Now, as I said, I support the bill as is, but we all have to be realistic. Washington is dysfunctional. We have people that are extremists on both sides that can't get anything done. And I'd like to see us make that progress. At least it would be a big win for us if we could reduce that age, and then maybe sometime in the future we'll be able to get enough votes in Congress. We've got to keep electing folks to Congress that are going to give us the total bill. So I'm a kind of guy that wants to work with getting something done. As DA for 25 years, I got things done. I mentioned some of the stuff that I did, which broke barriers for women and for African Americans in my own office. Let's get things done, because we could fight forever and we're going to be in the status quo. And I think that if we had a bill like that to be alongside, maybe somewhere along the line, you know, history will be talking about the next giant step was Medicare for all, which, as I said, I'll vote for that if I get down here. But perhaps we're going to have to make small steps like we did from 1912 to the 2010 Obamacare. And I think that I have the skills to bring to that, and I think that we could accomplish a lot. But that would address the issue, perhaps, of premiums for older folks, because we have a pool of smaller. Thank you very much.
I just asked if any of the other candidates have a response to incrementalism, so to speak. Well, that's not quite what you're advocating.
No, I'm just citing history. That's what happened.
Okay. Any?
I mean, I think part of the we continue to be reactionary. The fact of the matter is that the mandated law for all persons to be covered has been done away with in this latest quote-unquote tax reform, job creation. And so we are now fighting for something when we really should have pushed harder, perhaps, for a single-payer Medicare for all policy. And if this is not the moment that we stand up and have the courage to stop fence walking and be bold, came up with Medicare and created Social Security. Paul Wellstone said, "We will all do better when we all do better." And now is not the time, I think, for the politics of incrementalism.
Very briefly, I endorse that 100%. I'm fully opposed to incrementalism. I think it'll muddy the water. It'll make it hard to achieve our goal. I think, the quote, you may remember Ross Perot, it's time to clean out the barn. We need a big change, and we got to go for what we really want and not water it down and do the incrementalism.
That's also to my point, okay? Once we have a bill that is all in, I will be all in.
We hear over and over again that government can't be trusted, that it does not perform goods and cannot be expected to provide these services adequately, and government bashing seems to be the norm among politicians. And yet we have a number of really wonderful public servants here. So we'll talk about this question that deals with Medicare. Medicare appears, at least on the administrative side, which is 1/3 of the cost of health care, to run more efficiently than private insurance. Medicare actually spends $8 billion of this is the CMS that runs Medicare, $8 billion to run a $800 billion federal program, which is 1%. But a number of the directors of Medicare, the Medicare services, are saying, look, we may be understating this a bit, and we should talk about 2 or 3% or 4% as the realistic charge for Medicare. On the other side, just on to finance care, and we're not talking about the administrative complexity of delivering the care that's associated with the multi-payer system. I'm talking too much here, sorry. But we're talking about 15 to 20% administrative cost. Is there anything that can be done to reduce the administrative cost of commercial insurance? Why is Medicare more efficient than private insurance?
You're absolutely right. Just crunching some numbers, all right? Right now, the amount of it costs for administration for private insurance is anywhere between 12 and 18%. Medicare, 2%. Right there, if we cut out all that administrative costs within private, we'll save $500 billion a year. Right there, we talk about $1 trillion waste in one of the questions. Right there, we have half of a trillion gone. There was a magazine, several years ago, in 2013, in Time magazine, Stephen Brill did an article. He followed the money, and it became increasingly clear how much it's better for Medicare versus private. It was one of the stories was a woman by the name of Janice S. That was her nom de pen. And she was 64 years old, having chest pains. They took her to the hospital with the ambulance. They checked her out. Long story short, she was okay. But they charged her for I want to make sure I get this right. I'm not a doctor. Troponin. They charged her $199.50. What did they charge Medicare? $13.94. All right? This is a woman who had no health insurance, and they took advantage of this. They also did a CT scan. Charged Janice $7,997.54, and you'll never guess what they charged for Medicare. $554. The profit motive, as Susan spoke to earlier, has got to go. And that same hospital where she was treated, it was Stanford Hospital. In 2010, their expenses for lab work was $27.5 million. And their total charges was $293.2 million, with a delta of $265.7 million of profit. We have to take the profit motive out of healthcare. Here at the end.
The short answer to why Medicare is more efficient and has a smaller operating cost is because it's not profit-based and because there are no executives getting rich. That's the difference. The insurance industry has overhead that consists of executive salaries that eat into the costs of our medical care. That's the plain and simple answer. You simply have to take profit, corporate greed, and high-paying salaries out of this system.
You want to decommercialize healthcare.
Absolutely, absolutely.